And throughout the year, what we've learned as a hospital, we learned that it takes a concentrated effort to succeed. First, we need top-notch professionals from different departments with different knowledge base, with well-defined roles and workflow. I think this image depicts this well. It's not a one-man job to do this. It really takes a team to a well-coordinated team to do that. And I'd like to explore more about our own experience. So, from July 2019 to this past August, more than 70 solutions were assessed by our team. Actually, we got in contact with more than that solution, but I would say that only these 76 solutions were interesting at first for our imaging department. From that, we have 38 companies with ongoing projects right now, and 31 solutions that haven't met the expectation. They were discarded, not because they were bad, but they didn't met the expectation or didn't fit in our own needs, in our hospital's needs. And only 7 solutions have been deployed and are integrated in our clinical routine. I like how this image depicts well the importance of their process, because it really shows you how difficult, how hard it is to make the buying decision. But this is the past. I would say that this is how we made our buying solutions. But if you think about the other numbers that I showed you before, the number of FDA products available, the number of research publications, and the number of solutions that were integrated, we see a huge gap between that, And I see also a limit to this process that we have here. We put together a streamlined workflow which is efficient, but not scalable. Thus, you're urging the team to find the solution to enable that. So, what do we need to take the next step, to scale all this process, to be able to assess that 20,000 plus articles and 500 plus solutions? We understood that we need to make new partnerships, especially with companies that work with systems or with platforms. And that was our initial conversation with CARPL. Because that platform have many features that make our lives much easier and was made to scaling up. So through the platform, we can easily connect with more than 100 solutions and from different parts of the world, and test and run those algorithms in our own data and have everything easily available because we already have the platform integrated into our system. Also, one major challenge that we faced in the beginning was to connect with different companies outside Brazil or even the Americas continent. I'd like to stress that CARPL is not only a platform, but also a team that we are very happy to build a long-term relationship, because in this way they can better understand our hospital needs and suggest better solution for us, which is beneficial for all the parties, for the hospital, the companies, and the platform itself. So, in conclusion, I would like us to answer the question, how can a partnership with a platform expedite the buying decision and implementation of AI in hospital? I would say, first, you need to invest in people. You need to have good professionals, a multidisciplinary team that can address different considerations from technical, legal, and clinical aspects, to name a few. Then you need to streamline your workflow so the work and the time of your team is fully optimized. However, as I mentioned before, there's a limit for that because this process is not scalable. So that's when I think a platform can help to take the next step, to scale up the buying decision in a very efficient way. Thank you very much. That's my presentation. I'm open to questions right now.